15 minutes behind schedule. Let's try to catch up a little bit. Our next speaker will be a introduction, but I'll do it anyway. Bram is the founder of Hampton Healthcare China. Bram has been active in this sector in China as long as anybody in this room, and is a frequent speaker at events like this. So without further ado, Bram.
All right, thanks very much. I appreciate it. It's good to be back here today. I'm going to give a talk today that's separated into two parts. The first part's going to be a little bit of data from two different surveys that we did, one in Chongqing and one in Qingdao. Both surveys were sponsored by local developers in their efforts to build large senior living complexes. One of these projects is under construction and one of them is not. The data is a little superficial and I can't give away all the data, otherwise I'd be giving away everything that I know. But I'll give you a sense of exactly the situation that we encountered and why that led to at least one of the projects not going forward or having to be sort of rethought. The second part of the discussion is going to be essentially a discussion about data coming from a database that we maintain here. And it's all about what I would call, or what Mitch has termed, the fat middle. Maybe it's a little bit of the lower part of the fat middle of nursing homes in China. And those are nursing homes that usually charge anywhere from maybe 1,500 to 3,000 RMB per month, 3 to 4 people in a room. It's the stuff that has been built over the last 15 years here in China. Again, I run a company called Hampton Herder Healthcare. There are a number of companies that are fall under the umbrella of Hampton Herder Healthcare. We run a company called Worldwide Geriatrics, which imports specialty products for geriatric care, nutrient supplements, ointments. We have agreements with 2 French companies, which we're sourcing all that product today. The other company that we started just a little while ago is something called the China Geriatrics Institute. It is a training program for developers in Wenzhou, and we're training a few dozen Huliren right now, augmenting their Ministry of Civil Affairs certificates 3, 4, and 5. This company down here is sort of a work in progress. It's something that came about after discussion with somebody who was trying to do something like that. It's really a computer application that interfaces between patients, caregivers, and the patient's family. And then we've been looking at India for a little while. The demographics in India are not as urgent as they are here in China, but there have been some projects, some very interesting projects in India. We've been working on one in Mumbai. It's a combination, it's sort of an intergenerational opportunity with a high acuity point in it, and that's exactly where we've been working. And of course, as probably most of you know by now, the incessant marketing that I'm doing, I wrote a book, and the book is outside. I've gotten some interesting reviews on it, and there'll be a part 2 coming out in June of next year. It's called Dragon with a Cane. All right, so our survey in Chongqing was done in really the first half of 2012, and it was done under the sponsorship of a developer who was building, who wanted to build a relatively large project north of Chongqing in a place called Yishan. And it was a fairly large survey. There were over 500 participants, all of whom had Chongqing Wupo. The majority of them were relatively old, not high acuity or nursing home old, but they were all fairly aged. We provided what's called a lucky draw incentive to get people to sit down at the table. We gave away a few iPads at the end of the week. From those 500 or so people, we narrowed it down to 5 focus groups because some of their responses on the survey were relatively interesting, and we wanted to learn more about why they responded in such a way. Profile of the interviewees, they were all people who were state-run company, high-level employees. From what we could glean, wealthy individuals, high-ranking local military officers. In all, there were about 30 questions. We tried to devise this trigger for veracity, what we called, because we sensed that along as we were going through the survey, and this is true for a lot of surveys, and sometimes you get people who simply aren't giving you the truth about the situation. And indeed, we had a problem like that, and we had to dismiss about 15% of the total responses because they just simply were in conflict with other questions that we asked. So at the end of the day, a couple of the simple Chongqing tabulations revealed that a majority of the respondents wanted to stay in the city, which was a problem because the project that was being built was way the heck out of the city in the countryside. And so that was one of the first strikes against the developer. And interestingly enough, a lot of these people who were being interviewed had access to special hospitals. There are a couple of very high-end hospitals in Chongqing, and as a retired military officer, you had access to this hospital, and that's a hospital that you wanted. But if you were way out in the countryside, it would be hard to be able to use this hospital on a daily or weekly basis. So that was another issue that we had to confront, and another issue that led to sort of the cessation of the project. The other interesting thing was that a lot of these individuals really didn't have an interest in large amenity packages, big clubhouses. They had almost no interest in golf courses. But at the same time, a lot of these respondents said that they'd be willing to pay out of a budget question, sort of, how much would you be willing to pay for these type of services? Everybody would always say, we'll pay the highest price, right? Which gave us a pause for thought as to whether or not we were really getting the honest answer right there, especially if they'd never played golf before, if they'd never done any of these activities which were being proposed in the amenity package. So, the other interesting thing was that, at least in Chongqing, the children who accompanied the parents in Chongqing, a relatively small portion of them reported that they had a major influence in the buying decision, which was a little bit surprising to us because we always thought that the children had a big choice in the buying decision. Earlier this year, we did some work in Qingdao, and it was a bit of a smaller survey. Methodology was essentially the same. Profile of people that were surveyed was essentially the same. However, people in Chongqing, people in Qingdao responded in a bit of a different way. And while it's not all that practically interesting to compare the two, it's interesting to know that the people in Qingdao wanted to live in the countryside and not in the city. The same issue with the hospitals. I wouldn't expect that to have changed. Attachment to a hospital, the result of where you worked, shouldn't change throughout the entire country. The same cultural aversion to these amenity packages appeared in Qingdao as well. But in Qingdao, children reported that they had significant decision power over what their parents were about to do, probably because they were going to buy it for them. But why that should differ between Chongqing and Qingdao, I'm not entirely sure. I guess that's a sociological question or a cultural question, the way Shandong differs from the municipality of Chongqing or southwestern central China. But it's sort of interesting to think that why Qingdao must be so much more conservative in a way. When you compare the two against the entire tabulation, people in Qingdao reported that issues like feng shui and traditional Chinese medicine were absolutely essential to them when considering a retirement home, significantly more than residents of Chongqing. Residents of Chongqing, as you know, wanted a downtown city location as opposed to a country location. Being a downtown city location, it's hard to build a CCRC in downtown Chongqing. It's just not going to happen. First, one, because you don't have the land. As I stated, children in Qingdao really had the decision-making power over whether or not they're going to buy this place. But residents of both cities said that they really weren't entirely entirely interested in a CCRC, right? And that's sort of interesting because that'll fold into part 2, what I'm going to talk about next. And residents of both cities expressed a skepticism that this kind of a project was actually going to be built and realized. Part 2 of this discussion is, one half of it is some data that I collected right about the time that we were in Chongqing doing our work there. And it was tabulations of a database that we began to collect on these modern CCRCs that are being built in China today. And we found that we collected information on 30 different projects, and we learned that there was a relatively low occupancy in all of these brand new CCRC projects. And that was for a number of different reasons. One is because they were very new, but we began to see, as we tabulated the Chongqing data, we began to see that there was simply almost an indifference to living in this type of a facility. But of those projects, there were about 12,500 beds, and cost was somewhere in the low teens. And then we asked ourselves a question, what's going to happen over the next 5 to 10 years in the CCRC market? And we learned that there were about 450 of these projects under construction throughout China. And if you used our average of about 400 to 500 beds per facility, and you multiplied that out, took a small cut for some projects, the fact that some projects won't ever be done, we came up with a total number of beds that were going to be constructed here in these CCRCs of something on the order of 170,000 beds. But only 4,000 beds, a little over 4,000 beds were occupied today. And so how you go from 4,200, how you get the absorption to go from 4,200 up to 170,000 began to sort of plant the seed in our heads that maybe the CCRC thing wasn't really going to catch fire here for quite some time. Then earlier this year, we augmented our database with what I call sort of the long-term care, subacute care part of the industry, which is the lower end of the high acuity nursing homes here in China. Nursing homes that, as I said, when I started here, are about 1,500 to 3,000 renminbi per month. And if you look at the total population of China, there's about 40,000 of these facilities built over the last 15 to 20 years. And if using an average, it's sort of a gross average of 150 beds, you come up with something on the order of 6 million total long-term care, high acuity beds here in China. And these are pretty much all full, right? And there are long waiting lists for a lot of them. And so then we asked ourselves, we took that well-known 180 million, 185 million number, that population figure, and we asked ourselves, well, what's the penetration rate for this type of facility here in China? And it's a simple matter of division, but if you take those total number of beds and you divide it into that 180 million number, you come up with about a 3% penetration rate, which is helpful because we're going to project that out in the future, and we're going to see what needs to be done here over the next 10 years. And by the way, that 3% penetration rate is sort of interesting in comparison when you look at North America, which is penetration rates about 7 or 8%. If you look at Japan, Korea, and Taiwan, penetration rates for this type of product are on the order of about 10%. So without a whole lot of science, we just sort of applied the mathematics. And if you believe the demographics are going to be on the order of 250 million people in this age cohort in the next 10 years, and you take away the existing number of beds, and you use that 10% just as a starting place to have the debate with yourself, as a place to begin the argument, that means that you're going to have to build about 1.9 million long-term care beds per year to be able to address the demand here, to be able to come up with that penetration rate. 1.9 million beds means almost 13,000 facilities per year for the next 10 years. Now, I'm assuming that these beds take up on the order of about 50 square meters per bed, with 150 beds per facility, using a construction cost of about 4,000 RMB per square meter. Now, I know there are facilities in Beijing that are being done at about being done at about $1,000 US, maybe even a bit more per facility. But for this type of facility, I'm assuming something on the order of $600 US per square meter, finished, no soft costs. Again, if you do that math, and you multiply that out, it's about 30 million renminbi per facility. But if you got to build almost 13,000 facilities per year, it's almost 400 billion renminbi per year. And for those of you who want to talk about dollars, that's 60 billion US dollars a year, which is a frightening number. And that's only the hardware part of the problem, right? We haven't even begun to talk about the healthcare costs, right? The amount of money that's going to cost here to service all those individuals who have multi-morbidity, polypharmacy issues. We don't know what that's going to cost right now, but it's going to be a very big number, especially if you're talking about 250 million people. So the magnitude of this problem is a frightening problem, and I'm not exactly sure how it gets resolved. Even if you drop my penetration rate down to 6 or 7%, you cut this number in half essentially, it's still an enormous number. I don't see how they address this problem here with the current budgets. That's pretty much the end of this talk. I think we probably have a few more minutes. If you want to ask me some questions, I'm happy to answer those questions. But that's where I am. No questions? Okay. Thanks very much.